One of the most common questions I get from my patients is, how come my pain has gotten so much worse all of a sudden and there's no changes on X-ray or MRI or any imaging? Well, what may be happening is your pain is going from an acute pain to chronic pain. So let's back up and let me educate you on exactly how the central nervous system works. So think about the fact that your central nervous system learns through repetition. So if you do something repetitively, such as playing the piano, at first it's very clunky, it's hard to do on your own, and with constant activity day after day, it suddenly becomes second nature. You can do it without even thinking. Now the reason that happens is that there are changes in the brain and spinal cord that allow for that transmission to happen more efficiently. And it does three things. The first thing is, it allows that transmission to happen at a lower threshold. The second thing it does is when it does trigger that signal, it happens much more intensely. And the third thing it does is it happens for a much longer period of time. So that's really useful if you're trying to play the piano or if you're trying to shoot something with a bow and arrow, but it's really bad if you have some sort of nidus in your body that's causing constant pain. So let's say you have a bad joint in your neck, and every time you turn to the right, that joint fires pain. Well, patients can live with this for a number of years, and then all of a sudden it can really take off. It starts to become more of a burning pain, more of a diffuse pain, and starts to spread in areas that don't seem to have any sort of physiological basis. Well, what's happening is that those changes are happening in your brain and spinal cord. Remember, lower threshold, more intensely, and for longer. Great if you're learning the piano, really bad if you have a chronic pain issue. So the way we deal with this is we proceed by doing some blocks or some ablative procedures or some medications to try to tamp that from happening. So any kind of habit, if you can stop it from happening initially, there's a chance you can unwind it. Just think about your computer like it's locked in a re-entry circuit and you shut it all down and you reboot it. If we can do that with some issues that are becoming from acute to chronic, we have a high chance of success. If this is allowed to go on for years and years and years, then it can possibly become permanent. So that's why it's important. If you notice a sudden increase in your pain that's out of proportion to what it was before, nobody seems to be able to find any lesion, any kind of imaging, you might be going from an acute to a chronic state, and that's when you should get into a pain physician and talk to them about these topics. So I hope you found that useful. We're going to explore this topic a little more in the future, and we look forward to talking to you next time.